A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow. LIFTT, L-I-F-T-T as we like to call ourselves. LIFTT is what is known as a Center for Independent Living, meaning that we are a nonprofit advocacy and resource center for persons with disabilities who wish to be as independent as possible. We offer a myriad of programs and services to help persons with disabilities and the aging community meet that goal of continued and sometimes achieve independence. For more information about LIFTT, please give one of our offices a call in Billings. That would be 406-259-5181, or in Glendive, 406-948-8500, or visit us on the web at LIFTT, that's LIFTT, LIFTT.org. Now, LIFTT serves 18 counties, and we're glad to have a presence in all of them, but today we're actually going to be focusing a little bit on Yellowstone County, and that's because we have Amanda Zimmerman here from the Healthy by Design Yellowstone Coalition, and the coalition, along with it, the healthcare, pretty much the entire healthcare community in Billings is engaged in a community health needs assessment and is looking for the public to give them a hand. Amanda, welcome.
Thank you for having me.
And let's start off by talking a little bit about what is the community health needs assessment.
Yeah, so the community health needs assessment really is a wellness check for our community, for Yellowstone County. It's a way for us to help identify areas of opportunity, maybe service gaps and barriers when it comes to the community's health and well-being. In 2000, the CEOs of Billings Clinic, Intermountain Health St. Vincent's Regional Hospital, and Riverstone Health, which is the home of the city-county health department, formed the Alliance of Yellowstone County. And really that was this partnership to really out of that shared recognition that if we work together, we can get a lot more done when it comes to meeting the needs of our residents in the county. And so the first Community Health Needs Assessment Survey was conducted in 2005, and then in 2010, the Alliance has done it every 3 years, and the last couple of years it's been done in partnership with the Rehabilitation Hospital of Montana, and of course Healthy by Design too. And
all of those entities you mentioned doing this needs assessment is part of their requirements for certain funding?
Yeah, so the Community Health Needs Assessment is required for nonprofit hospitals to meet IRS reporting guidelines, and it's also required for health departments who are publicly accredited by the Board of Public Health. It's required for hospitals every 3 years, required for public health departments every 5, and so Yellowstone County, as the Alliance, we just do it every 3 years to stay in sync with the hospital's needs.
Okay, that's good, and it's good that you're not out there trying to do 4 or 5 of these
yes.
at various times. So how is the assessment done? There's several ways you gather information, if I remember correctly.
Yes, yeah. So the Community Health Needs Assessment, really community engagement is key for the process, and so we work with advisory community members to really help us advise the survey process and the questions we ask in the survey and just overall process of it. We also ask 300 community leaders and organization leaders or special interest groups, faith organizations, nonprofits, 300 individuals to do a extra key informant survey to give their firsthand knowledge, perspective of what's going on in the community. And then we also work with community health workers across Yellowstone County who are working with historically marginalized populations or populations that may be historically under-resourced to really understand health needs of certain populations. And then we have our survey that's going on, and the general public we have is able to take this survey. It's an online open link survey, and it's about 110 questions. It takes about 15 to 20 minutes, and that's just another way that we are able to gather community feedback. And then also we work with a third-party consultant to conduct some phone surveys too.
And about 400 of them?
Yes, yeah.
Yeah. In the interest of disclosure, LIFTT, myself and another member of our team who's a community health worker in training, although I think the training's almost complete, participated in, I can't remember what you called that committee.
Yeah.
And several LIFTT personnel received that additional survey as well and
yes.
completed it. So you gather all this information from all of these sources. What sort of is the next step, I guess?
Yeah, so the community health needs assessment really is, it helps us determine overall health status of our community. So it's looking at a lot of kind of broad topics when it comes to community health. So anywhere between Yellowstone County community description, demographics, social drivers of health, overall health status, mental health, modifiable health risks, death, disease, chronic conditions, infectious disease, births, and access to health care. And so we have people, we ask that they take this survey, they provide their feedback on their firsthand experience in our community, and then we work with PRC, which is a third-party consultant, to help us gather the data, make sure it's representative of our community, and then we have a public forum, and that's where we invite all community members, residents of Yellowstone County, to learn about the results of the needs assessment survey. And then the community members also help us rank the health needs, so looking at ability to impact and scope and severity. And so really from the survey results and the needs assessment process and community feedback all along the way, it really does, the results we get and from the public forum really help guide and inform what the Alliance will focus on over the next few years, and also other local organizations, and where resources, funds, really should be allocated for to meet needs of the community.
So it's sort of a responsive planning process that you see what's out there through the assessment, and then through the is it the health improvement plan?
Yes.
Or
yeah.
Health improvement plan, you say, here's how we're going to meet these needs that we've identified, correct?
Yeah. So after the results, are presented to the community and they're prioritized and it's all brought to the Alliance, then there is a community health improvement plan, which is what you just brought up, and that is a collective effort that the Alliance does together, where it's really initiatives to help identify the areas of opportunity that are identified in the survey. And the hospitals will also have their internal community health improvement plans, but we also collectively have the community informed and owned community health plan, or CHIP is what we call it.
Mm-hmm. And out of that, and out of this needs assessment over the past 20 years now, 2005 was the first one, and then it became a 3-year cycle in 2010. A number of things that are visible in the community have resulted, correct?
Yeah, definitely. And so, yeah, the historical approach really started with kind of looking at even from the 2010 one, it was around kind of healthy weight and how to address that for our community. And then since it's, we've added kind of based on the needs identified, various initiatives that will focus on, the priority areas around mental health, access to care, and substance misuse as well have been top ones that have been added throughout the years.
Mm-hmm. Okay. So, so there's 150,000 people in Yellowstone County now, I think, or even above that. But how many surveys do you get back, and how many would you like to get back?
Yeah, definitely. So our third-party consultant, like you had mentioned, they do the phone surveys, and they help us get 400 phone surveys. And then we do that online link, which is open to anyone to take, which can be found on our website or social media. Last cycle, so 2023, was the first time we actually had an online option. Before that, it was just the 400 phone surveys. So we've really been able to increase the amount of respondents, even from that last cycle and this one too, and increase diversity in the respondents and lived experience. But last time we got about 295 online responses in addition to the 400 phone calls. And so we would love to at least hit that or go over that mark for this time. We're close, but not quite there. But then of course our PRC will help us, no matter how many surveys we get, make sure it's representative of the demographics of our community.
But there's a broad cross-section of who actually lives here, and it's interesting having participated in some of the background to see that that there's more. We talk about a lack of diversity in their community, and compared to some places that is true, but there is more than people give us credit for. I would think, particularly in the last number of years. So maybe take a minute or two and talk about the organization. You're employed by Healthy by Design. What exactly?
Yeah, so like I had mentioned, the Alliance was formed in 2000, and then they completed their first needs assessment in 2005, and then after that, in that next round, about 2009, they then created Healthy by Design. So it was in an effort to help address the needs identified and carry out initiatives, working with the community partners, stakeholders, to work on initiatives to address things that were found in the needs assessment. That's where Healthy by Design came in. We focus on community health initiatives that are more about policy change, systems change, and environmental opportunity built environment changes. And so looking at initiatives that will address root causes of health. And so when you're thinking about maybe it's built environment, looking at safety in terms of neighborhoods, walkability, food access, like our Gardeners Market, looking at like community health workers in some of our initiatives around like improving access to care and building community capacity, and really bridging the gap between community and health and social services. And so so every once the needs assessment is conducted every 3 years, that's all brought to the community, and then Healthy by Design works with community members, organizations, nonprofits, to work on initiatives that can address the health needs.
And some of those initiatives are ones that LIFTT has been privileged to work with Healthy by Design on. And again, as I said, we have a community health worker in our Billings office who's on the verge of having her training and certification completed. We've, again, the gardeners market is something that we hear, you know, in passing from our consumers. They, particularly the ones who live right there in that South Park neighborhood, really enjoy. We've done some tabling there, although it's, although now you've got so many folks who want to sell vegetables that it's harder to, you're not calling me as much as some of your predecessors who would say, we need somebody out there, which is great. I'm not complaining. Again, and it's a bit of a time of transition for, I don't know how again, one of the things the farmers market pushed in years past was, you know, extending folks benefits by shopping at the farmers market. Does that still exist, or?
Yeah, so the Gardeners Market we started in 2011, and it was, the mission of it is to provide fresh, local, affordable, healthy food and produce to community members. And it started in the Riverstone parking lot, but then since after a couple of years there, it moved over to South Park. And another one of the reasons we hold it at South Park is because that Southside Triangle neighborhood is a USDA designated food desert. And so, but it's open to everyone in the community. We do take SNAP and WIC and debit, credit, cash, a variety of different payment options to help with the accessibility piece of fresh produce. And so, yeah, we're always looking for new faces. We're happy to see new faces at the market. Anyone and everyone is welcome to attend. And yeah. That's
Thursday evenings?
Thursdays.
Through October?
Yep. Second week of June to the first week of October. Every Thursday from 4 to 6.
Okay. And what are some of the other initiatives that Healthy by Design has been involved in?
Yeah, so I did mention that we've helped work with a variety of different organizations around like community health workers and that, looking at workforce sustainability and helping sustain that workforce and support that workforce. We also are working closely with Allies in Aging and other partners and stakeholders and organizations for the group of age-friendly Billings. And so that is a group that is really trying to ensure that Yellowstone County is just you can age, anyone of any age can age friendly. And so looking at different initiatives, you know, maybe around transportation access for older adults, or we're also, it's an AARP framework domain that we're focusing on, so it's about 5 of those that we're looking at. And so looking at like transportation, outdoor space, public outdoor space, respect and social inclusion, employment, and a couple others. And so different initiatives around there. One of the things that just happened recently at LIFTT Park, the group had gotten a AARP grant to put in some age-friendly park equipment. So it's actually a balance board that was installed at the park for anyone to practice their balance. So,
and again, LIFTT had a hand in not necessarily that grant, but the trail that runs by LIFTT Park. There was it was in need of repair, and there was some bollards that needed to be removed, and so LIFTT and Billings TrailNet took the lead, but LIFTT provided some technical assistance in helping to secure a grant from the Montana Department of Fish, Wildlife, and Parks for that. So it's nice to see that these projects complement each other, and that, you know, LIFTT Park is becoming a neighborhood gathering place in that particular part of town. Few minutes left here. So let's go back and so how do people find the survey and what can they expect when they do?
Yes, definitely. So again, the survey is open for anyone 18 years or older that are residents of Yellowstone County. You can find the survey on our website at healthybydesignYellowstone.org or hbdyc.org. And if you go to the Community Health Needs Assessment tab, the link is right there that will take you. You can also find it, we have it on our social media, the links and the flyers, and so Healthy by Design is on Facebook. We're also on Instagram, where you can find that link as well. And so yes, it is open until August 25th and open to anyone to take.
And okay, that's great. Amanda Zimmerman, thank you for joining us on, again, LIFTT values its relationship with Healthy by Design and with the other members of the healthcare and wellness community in Billings, and so it was very nice to have you here. Again, this has been Living Well in Montana. My name is Jed Barton. Living Well in Montana is a program of living independently for today and tomorrow, LIFTT, and we provide programs and services to promote the independence of the aging and disabled throughout our 18-county service area, which includes Yellowstone County, but goes all the way from the North and South Dakota borders out to Stillwater and Golden Valley County. It's quite a chunk of southeastern and south central Montana that we serve. So if you're in that part of the world or know somebody who would be interested in learning more about our programs and services, have them give us a call at 406-259-5181 in Billings or 406-948-8500. We'll get you our Glendive office for those of you in the eastern portion of our service area again, and we're also online at LIFTT.org, and you can find us on Facebook and Instagram as well. Thank you and good day.